So the next bone we'll do, moving on from the femur, will be the tibia, which is the medial lower leg bone. If we look at our right leg model here, we have our right femur, which is here. Down here, here's the medial lower leg bone compared to the lateral lower leg bone. So here's the tibia on the medial side, and the fibula is on the lateral side. Both the tibia and the fibula are in the lower leg from the knee to the ankle, so we would call these the crural bones. So first we'll talk about the tibia. Both of these here are right tibias. The main way to tell the tibia, the orientation, is to look for this structure right here, which has the black tag on it. This is called the tibial tuberosity. It always faces forward or anterior. And then distal end, find this big knob of bone here that's marked in blue over here. This is always on the medial side. So this is medial, this is lateral, and this is anterior. Now at the top, at the proximal end of the tibia, we have this wide structure called the tibial plateau. Tibial plateau is made up of a few structures. First, this large medial condyle of the tibia, which is right here, both on the top, in the front, around the side here, and to the back. This portion articulates with the medial condyle of the femur. Then across from it, we have the lateral tibial condyle, the structure right here. And then it articulates up top here with the lateral femoral condyle. And then in between the medial and lateral tibial condyles, we have this structure here that has two horns, a medial and lateral horn. This, marked in red, is called the intercondylar eminence. That's the structure that when we put the femur and the tibia together at the knee joint and we bend or flex at the knee, we can see that that intercondylar eminence right here slides into that intercondylar fossa of the femur. We can even see that from the posterior side here. Here's the intercondylar eminence. Here's the intercondylar fossa. Here's the intercondylar eminence right here, so that can glide through there. And we'll find in the joints, the articulations, that there are ligaments that crisscross inside of here, called the cruciate ligaments. Okay, so finishing up with the tibial plateau, we come back to our tibial tuberosity. This is an attachment site for the quadriceps muscle. Then if we look kind of to the medial and lateral side of the tibial tuberosity, we have on the proximal tibia, we have on the medial side, we have a flat surface area here. This is a landmark region on this proximal medial tibia where we're going to find that three muscles attach just like this. And they actually create this three-pronged pattern where they attach that looks like a goose's foot. So we call this the pes anserinus. You can also refer to this as the SGT section, which is actually marked on this leg right here. So here we have the knee joint, the femoral head's up here, so this is the medial side. So on the proximal medial tibia, this pes anserinus, we find the SGT marked here, and this abbreviates the muscles that attach here, which is the sartorius, the gracilis, and the semitendinosus. We don't have to worry about these three muscles right now. We'll worry about those in the muscular system. But what I want you to focus on is knowing that the proximal medial tibia is this pes anserinus where three important muscles attach. Then if we go to the lateral side, on the proximal lateral tibia, just below the tibial tuberosity right here, and we can even see it on this bone, this tibial bone really well, there's this structure right here called Gerdy's tubercle. Gerdy's tubercle is actually one of the attachment sites for the iliotibial band, and we'll talk more about that in the muscular system. If we continue on with the tibia, we have the body or diaphysis of the tibia. We can see on the body or diaphysis, I've marked it on this bone in green, kind of outlining it there. And then on the anterior side of the body or diaphysis of the tibia, we have this orange line, which is this anterior crest of the tibia. When we get to the distal end of the tibia on the medial side, marked in blue, is the medial malleolus. Then we have some other articular structures that we're not going to worry about right now. We have this distal articular structure for the fibula, and then below on the inferior side, an articular structure for the talus at the ankle joint.